Hey guys, it's Daniel, licensed therapist. Whilst perusing the interwebs, I found this interview between Joe Rogan and author and reporter Abigail Shrier, who apparently thinks that therapists have completely ruined Gen Z and made them a bunch of pansies. My first thought was,
Oh, hell no!
and then I thought, really? It's therapists that's responsible for a whole generation? And so, as a therapist and as someone who's apparently complicit in the decline of Western civilization, naturally I had some thoughts. So, let's get into it.
The problem, as I see it, is not that you're not saying suck it up. It's that no one ever says suck it up, no matter how minor the scratch to these kids. Okay. And sometimes being told you'll live. Remember when dad used to say you'll live or, shake it off? We never hear shake it off anymore. No one says it. So they don't know they can overcome even minor injuries. And the truth is they can. They can. But they recently did these studies on these, coping techniques. They taught coping techniques to teenagers, over 1,000 teenagers in Australia. It was called the Wise Teens Program. They talked to, that was the point. It was just to help them with emotional regulation. And it turned out it made kids sadder and more anxious. They measured this. And the reason was regularly ruminating on your bad feelings can make you feel worse.
Did you talk to therapists when you did this?
Yeah, a lot of therapists.
Yeah. How many of them agree with you?
So there was a huge split. The academic research psychologists overwhelmingly agreed. They were aware of the literature and they said, yeah, these are bad practices. Here are things we shouldn't be doing with kids. What was interesting is a lot of the clinical therapists were either minimized the risks of therapy or denied that there were any.
I look at this part of the interview and I'm thinking it's extremely vague. I don't know exactly what she's talking about. What are these harmful interventions? And what are the bad practices that the research psychologists are saying that we shouldn't do? And I don't want to just right off the bat disagree here because I know it's a small snippet of the interview and I'm sure there's a lot behind the things that she's talking about, but I do want to say this. I'm licensed to practice psychotherapy in California, and in order to uphold my license, I have to do what we call continuing education units, which is basically taking classes and continue my education so that I'm up to date on the current trends of mental health and therapy. And do you know who does a lot of these trainings? Research psychologists. Yeah, it's the research psychologists that actually do trainings on what they're researching. So it's not like therapists aren't up to date and in contact with research psychologists. I mean, Abigail makes it seem like the research psychologists are monks on an unreachable Tibetan mountain. I literally take classes every 2 years, and if something I was doing was actually harmful to my clients, I'm pretty sure I would have caught wind of it now. And at the end of this segment, she does a little bait and switch. She says that the practices are harmful and that therapists minimize or deny the negative effects of therapy. Sure, maybe there's harmful practices, but therapy as a whole being harmful. So I felt like that was a little disingenuous. And honestly, it kind of made me want to say, what's the worst thing that can happen in therapy? We're just talking. Maybe you lose a little money and time, but I can't say that because that would actually be me minimizing the negative effects of therapy. But you know what, guys? I actually think that she does have a point. How can therapy be harmful? Well, you can actually collude with dysfunctional thinking and you can reinforce it and validate it. And if you do that, you will continue a dysfunctional behavior. And so clinicians have to make that clinical choice of when to validate and when to challenge. And so if there is no challenging and there's no change, then sure, I can see how that can be harmful. So in a sense, I agree with Abigail. This could happen, but in my opinion, it's more a failure of the therapist not making a good clinical decision rather than therapy as a whole that's failing society. Let's keep going.
But isn't that like Jiffy Lube? Like when you tell them, you don't need to change your oil that much. Well, it's their business to change oil.
Right. Exactly. So like I talked to this one amazing, child psychologist who said to me, I start by having my patients sign a waiver. in which they acknowledge that there can be risks. And the reason I do that is because I don't want them to experience harm. So if they see that their worries are getting worse, they have to tell me.
Huh. But do they? Would they? I mean, it seems like the therapist is the one who's in control, right?
Right.
The therapist is the expert. They're the one who has the authority.
Right. Well, I mean, this one was Camilo Ortiz was one of the, he was the one I talked to, and he was the one that I was referring to there. And first of all, he always starts a therapy by setting the number of sessions. It's not, he doesn't treat a kid like an annuity. You're going to, be my income stream for years.
Right.
He attacks, and also they come to him with an actual problem, like chronic bedwetting, like, various kinds of phobia.
Mm-hmm.
There are people who treat anorexia. They're tackling a problem.
Right.
And some of those therapies are extremely necessary and very successful.
When this person that you were just describing, if they get someone that comes to them that doesn't have a real problem, do they turn them away?
Well, you can ask, but very often the therapists don't turn them away. That's the problem.
So have I turned people away? Actually, I have many times. So I have free initial consultations where I'll talk to and meet with the client for free the first time. And during that initial consultation, what we do, we just talk. I get to know the person. I find out what they're looking for in therapy. And after some of these initial consultations, I have told the client that I don't think they need therapy. I think that whatever they're going through isn't necessarily clinically significant for them to have professional help. And sometimes people would say, wow, that's amazing. Thank you. I feel so much better. I'm going to go on with my life. And that's great. They go on with their life. But then sometimes people say, okay, I understand. Thank you. But I still want to go forward. I want to move on with therapy. They just want a little more support. They want a place where they can talk and process. That's what we're there for. So we move on with therapy. And engaging in therapy with that person, I don't think is unethical. I don't think it's cheating them. I told them that they don't need it, but they still want to do it. And so it does happen. But I think that Abigail has a point. There are people maybe who don't have this conversation, and they do take clients who they feel like don't need therapy, but they do it just for the money. What is the percentage of therapists doing that right now? I don't really know. I'm sure people do it, but is it every single person? Is this just a widespread problem? I doubt it, but I don't know.
Also, the incentive is for therapists to treat the least sick for the longest period of time. That's the incentive. Because you don't want the schizophrenic patient who really needs you.
Right.
They're really hard to treat.
Almost impossible.
Almost impossible, right? You don't want the bipolar patient.
Right.
Some people will refuse to see those patients. But a teenager with a little social anxiety, parent pays on time, they're not getting violent in your session.
Oh, boy.
I guess that is a valid point. It is. It is a valid point. But you can say that just about every service industry profession out there. Think about it. A plumber, he can fix your pipe to break so that he can come back and get more work later. A mechanic, he can fix your car, but make it not the best so that it breaks down and you have to come back and see him again. A phone, they can make a phone, but hold back some technology only to release the phone with current technology later so that people have to buy another phone. Apple. Excuse me. Or you could have a reporter or media news outlet that can print fake headlines that aren't true so they can sell more newspapers or get more clicks. Abigail. But let me put it another way. The average salary for a therapist in California is around $70,000. Not bad, but not great. And I highly, highly doubt that there are people twirling their mustaches and going to graduate school studying psychology and psychotherapy with children with the intention of ripping people off for money. If you have no morals and you want to rip people off and get rich, there are much better ways to do it than to become a therapist. And I do have to say that there might be another business model that would also incentivize therapist to do a good job, the plumber to do a good job, the mechanic to do a good job. And that is to have somebody come and see you in therapy, do a great job in a short period of time, send them out into the world, and those people tell other people how much you've helped them. And then you get business that way. And she mentions how nobody wants to treat schizophrenia patients. And I really have to disagree with that. In fact, there are people who specialize in treating people with schizophrenia. The thing is, someone like me, I'm not specialized. So it's what they call out of my scope of practice. I don't know exactly how to deal with someone with schizophrenia. I would refer them to someone who's a specialist in schizophrenia so that they would get the help that they need. And that is the most ethical thing to do. I mean, does that look shady on my part? I guess someone could look at that and say, oh, you don't want to treat someone with schizophrenia. But no, I'm just trying to get that person the best help possible. My job isn't exactly easy. There are a lot of hard cases that I have to deal with within my scope of practice. But those I take on with the best of my ability.
Wow. I never really considered that until your book. Until I heard the title of your book and I read the synopsis of it. I never really considered it. I never considered that thinking about your problems all the time and talking about your problems all the time literally make the problems grow.
That's right. I mean, it's the number one symptom of depression is what they call rumination, this pathological obsessing over your pain.
Yeah.
That's why stuff like exercise, that's one of the reasons, aside from chemical reasons, one of the reasons that doing anything, that running errands is good for your mental health, getting out of your house and accomplishing anything is good for you. But sitting around talking and thinking about your problems, that's a bad habit. And the best cognitive behavioral therapists and others, the dialectical behavioral therapists, the ones who do really well with depression, the first thing they do is try to break that bad pattern. But a lot of therapists just indulge it.
So once again, I don't disagree with her logic. Sitting and agreeing and just talking about someone's depression is probably not helpful. But do you know what? If you think about the most common therapeutic modalities, I mean, let's throw out there some of the ones she talked about: CBT, DBT, behavior, systems, mindfulness, and narrative. All of these therapies are all predicated on change. CBT and DBT, it's about changing your thoughts. Behavior, it's about changing the antecedents or the rewards. Systems, it's about changing the systems around the person. Mindfulness, it's about changing your thoughts and being present. Narrative is about changing the story that you're telling yourself. There's only one therapeutic modality I can think about that actually is close to what she's talking about, and that is the classic psychoanalysis where people just free associate and the therapist pretty much just sits there and lets them simply talk. And this type of therapy was one of the first created, and it was created by Freud. So it's an older model. Some people say it's antiquated. I'm sure people are out there doing it today, but it is far from the most popular types of therapy. So I don't know exactly if she knows what she's talking about when she talks about therapy.
We should be telling kids is that the amazing story of human history is of resilience. It used to be the case that people lost a sibling. That was common. People lost a parent. That still happens, right? These things still happen. And the amazing story of human history doesn't mean it's not painful, but of resilience. They get on. They aren't permanently suffering with mental illness or mental problem. They form families. They are responsible in their jobs. They show up for work. They can be depended on by their friends. That's the story of human survival and resilience. And unfortunately, we're telling kids, no, you've had trauma.
Yeah. Yeah, you've had trauma and you need to work through that trauma.
Right.
It's not just, this is just a part of life. And, what you need to do is just go out there and live your life and you'll get over it.
And, the thing is, the truth is that most kids and most people did. In other words, that didn't mean that dad didn't lose his job and they were forced out of the, they had to lose their house, or these things happen. They've happened in every family. And I think one of the many reasons that kids don't know this today is we've cut them off from extended family. The story of their grandparents is a story of resilience in almost every case, right? You hear about your family history and you're going to hear a story of pain and survival. and resilience and overcoming. But today you've got teenagers who say, oh, I can't drive past my middle school where I was bullied because of my PTSD. They don't have PTSD.
So once again, I agree with what she's saying, but it's a little bit off. As a clinician, I know the criteria for PTSD, and I have a hard time believing that there's a bunch of therapists out there telling their clients and diagnosing them with PTSD when they don't actually have PTSD. So to pin it all on us that PTSD is out there and so commonly misdiagnosed, I feel like is a little unfair. I tend to look at the culture. There's just some clinical diagnoses out there that just make it into popular culture, and then everyone starts saying that they have it. ADHD, OCD, autism nowadays, and also PTSD. Once again, I agree with her, but I am failing to see how a bunch of people misdiagnosing themselves is the fault of therapists.
But they think they do. And
What do they have, though? If you are bullied, that does have a significant psychological effect on kids, and it can lead to lifelong depression.
I don't know that it can. I mean,
I
no,
don't think
sorry.
so. Like for young people that like get treated like shit and told that they're nothing and useless, and that sort of like when I didn't really get bullied in high school, but I remember going back towards my high school when I was like 19, and I'd get anxiety.
Right.
I'd get weirded out by it,
Right. So let me
'Cause
just say, yeah,
You start feeling like you used to feel when you went there.
absolutely. But that's not a PTSD flashback, right?
What is that?
That's a bad memory. And we have them. And by the way, when I say you can't have, bullying can mean anything, right?
Right.
So when I say, I'm talking about teasing. I'm not talking about the horrific abuse that some kids have gone through.
Okay.
But do you have anxiety? Yeah, anxiety exists for a reason. It's actually adaptive. And so there are benefits to anxiety and there are negative parts of anxiety. Now, I'm not talking about anxiety disorder. We don't want anyone to suffer with an anxiety disorder that interferes with daily life. But a little anxiety, feeling bad, and a bad memory, that's not only part of life, but it can have positive effects. So some of the positive effects of anxiety is it helps with performance. If I weren't nervous for this right now, I wouldn't have prepared so much to make sure I remembered what I was going to talk about, right? And we don't want someone with no anxiety crossing a street because he's not going to look for cars.
Right. Yeah.
And we're going in with medication and we're deleting things like anxiety, depression. Anxiety helps you make beautiful memories. You remember Christmas morning because of all the nerves about it ahead of time, or you remember your first kiss partially because of the anxiety. That's why the memories are so clear.
Right.
And when we go in and we give kids a pill for that, not only are they not developing an emotional musculature they're going to need as adults, but they're losing a really important part of the human experience, like feeling low because you were dumped and then seeing you can get over it.
Right. That's a very important thing what you just said about experience anxiety. It actually helps you be sharper.
It does.
It really does. You have to be nervous before you do things
That's right.
that are difficult. It's just that uncomfortable feeling people avoid
Right.
because they get scared of the anxiety. But if you talk to like one of the best examples is UFC fighters. UFC fighters before they're all nervous. They're all scared. Every one of them, terrified.
Right.
And they don't want to fight if they're not.
Right.
If you're too calm and too relaxed, you actually have bad performances.
And I'll tell you something else. Same is true with depression. Now, I'm not talking about major depressive disorder that's chronic and needs treatment, of course, right? But if you have something bad happen to you, you go through a divorce, you go through something hard, okay? That doesn't mean you should never try, use meds or therapy if you absolutely need it. But there can be good. And here's what can be good, okay? Depression is adaptive. Okay, and the purpose, I learned this from interviewing a lot of evolutionary psychologists. And one of the good things about depression is it shuts us down so we don't do anything rash and we think about what change we might want to make in our life. Because sometimes we need to make a change. And if we just medicate away the bad feelings, the worst feelings might be dampened, but we also might be locked into that low state and never make the change we need to make.
Right.
Because we'll lose the motivation. That's the thing. We won't say, you know what? He treated me badly. I'm tired of this. I'm not getting back together with him.
Right.
We might just accept it and keep on.
Right, especially if you're medicated.
Especially if you're medicated.
Man, I keep saying it, but I agree with her. a little anxiety is good. And I actually talk about this in therapy with my clients. And I use the movie Office Space as an example. If you have zero anxiety, you'll probably look like the guy from Office Space, which is not what you want to do. But wait, she says something very interesting. She says, there is a pill for that. A pill, it's not psychology, it's psychiatry. It's not therapy, it's medication. And it's not therapists, it's psychiatrists. I don't know if you guys know this, but there's a big distinction between therapists and psychiatrists. I'm a therapist and I have a master's, and there's psychologists who have PhDs, and all of us can do therapy, but we cannot prescribe medications. Only psychiatrists, because they're medical doctors, can prescribe medication. So there's a big difference between the two. And if you Google the highest paying jobs, look what we find sitting at number 4. So if you're somebody that lacks ethics and you want to make a bunch of money and you don't care what happens to people, you can twirl your mustache and look at the field of psychiatry and the occupation of psychiatrist, and it's possible that you can want to cash in. And look, I am not throwing psychiatrists under the bus here, but I am saying if you're going to make that argument about money, it makes a lot more sense if you're talking about psychiatrists and medication. But you know what? After over 20 years of being a therapist, do you know what I realized? Therapists actually have very, very little power. When a client does well, I take very little responsibility. It's them out there doing the work. Think about it. I see a client for 1 hour out of an entire week. That's less than 1% of the time. It's like you look at a personal trainer, they can't really take responsibility for someone getting into really great shape. Sure, they helped them. Maybe they showed them the way a little bit, but it's that person putting in the work. And that's how I see myself. And it's the clients that put in the work, and they deserve the credit. So when something goes terribly wrong or things go really right, I feel like I don't deserve credit much either way. And I'm actually wondering how many children are out there getting therapy so that it has this wide sweeping effect on all of society for an entire generation. Maybe it's a lot of people. The statistics I've looked up or that I've been able to find, it's somewhere between maybe 15 to 20%. It's a small, not an insignificant, but a small percentage of the population. So when you talk about influences on children, I think that there are way more things ahead of therapy. Off the top of my head, there are peers, mentors, or teachers, social media, celebrities, TV, movies, music, culture, and politics. But hey, isn't there something, just something that's like the most influential thing when it comes to children?
I don't know. Why is that?
Let's see if the voice of reason here, Joe Rogan, can identify that one thing.
It's weird because as a parent, like, you want to hear kids out. And when they're having like some sort of anxiety and issue, you want to talk with them and you want to talk through it.
Sure.
And you don't want to tell them, hey, you're going to have to suck it up. I never say that, and I probably should.
So that's what it is, guys. It's parenting. But do you disagree with me? If you do, let's duke it out in the comments down there. And if you have anything you want me to react to, it could be a movie scene or it could be another interview, leave it in the comments down there as well, and I'll try to get to it. Thanks for watching, you guys. I'll see you next time.